Welcome to another episode of United for a Healthy Stoughton. Today we're going to be talking about the Stoughton Youth Survey, and so I'm excited to have with me Kendall Bennett, who's our evaluator for the OASIS Coalition. So welcome, Kendall.
Thank you.
And Kendall is probably the only other person in the coalition who's equally excited about data and looking at all the stuff that we get to collect. And so she and I are going to spend some time talking to you at home about what we've learned from this year's Youth Health Survey. So I'm going to let Kendall introduce herself and tell you a little bit about herself.
Hi, I'm Kendall. I work at the Old Colony Y on a project funded by the Centers for Disease Control and Prevention called REACH. So we're working on some chronic disease prevention and management in Brockton and Stoughton. But outside of that, I also I have my master's degree in biostatistics, so I'm really passionate about data. And so I actually work as the evaluator for the Youth Health Survey conducted in Stoughton, which has been so exciting.
Great. All right. So we're going to talk a little bit, as we said, about data today, and we're going to start out, usually when I talk to folks about data, and I've been doing a number of presentations over the years, we try to think about things from a frame of hope and concern. And so this comes from actually some research that's done by one of our colleagues, Dr. Jeff Linkenbach out at the Montana Institute. And really, it's kind of a nice framework when we think about some of the things that we learn and what the surveys can tell us. And that is that there's a lot of things that our kids are doing well and are doing right. That's really positive. And then there are some things we need to be thinking about and some areas of concern and some things we need to work on. And sometimes both of those things exist at the same time. So for example, when we think about our substance use data and some of our kids are using alcohol and other drugs, but the majority of our kids are not, it's something both to be hopeful about, that most of our kids are making great choices, but some concern around the kids that are still struggling. So we want you to keep that in mind as we talk about the data today, but I think there's a lot of really positive stuff for us to be hopeful about. So we want to start out sort of sharing with you a little bit about what is the survey, what is it like? Kendall's going to tell you a little bit about that, and I'll pull up a little slide here. Oh, no, I will not. Hold on. Yeah, Kendall can start talking. Here we
go. So I actually took the first youth health survey that Stoughton gave out when I was in high school.
Awesome.
So it's exciting now for me to see a lot behind the scenes with it. But the Youth Health Survey in Stoughton is derived from the Youth Risk Behavior Survey, which is a tool used all across the country. Every question is heavily vetted and validated and has been practiced 1,000 different ways to make sure that the questions that we're asking is getting answers to the actual question that we want to ask. So, so this year, Stoughton, always being so progressive, did the O'Donnell Middle School survey online for middle schoolers, and then still did pencil and paper surveys at the high school. And as I understand, this was a decision that you guys had to do a lot of research on and a lot of practice, and it seems like the results came out just the way they would as a pencil and paper survey, so it'll be a great way for us to save some time and money in the future. But the teachers are trained in giving out the survey, making sure that the students know that the surveys are anonymous, and that the students feel comfortable to answer honestly to these questions. A lot of people have concerns that the survey isn't necessarily getting truthful answers, but we do have a lot of ways of seeing if answers are truthful. We make sure that all of the answers are consistent throughout a survey. We actually have a question where we ask if people are being honest, and in the end we really only have to remove a few surveys, a really small percentage, for dishonest answers or inconsistent answers. And all those tools are laid out. You can find them, I think, on the CDC website, ways to check to make sure that the surveys that you're analyzing actually, fit a true, consistent survey. But it really hasn't been much of a problem for most communities, as Stoughton included.
Great. Yeah, and it's been a wonderful experience. We've been doing this survey since 2005, and so we thank the Stoughton Public Schools because we know this is a huge investment in time for them to really give up a class period every other year when we do this survey, and the data is really, really valuable to all of us. So, which is why we want to make sure we're sharing it with the community. So I want to talk a little bit too about why is this data important. So actually maybe we can pull up, Jeff, for a second, a slide here. So there's a lot of research now really about childhood development, and some of our colleagues, Dr. Linkenbach included, have been looking at what are some of the keys for kids to be to demonstrate resilience? And a lot of their research has actually been around kids who have experienced trauma and who are struggling. But I think the research is applicable across the board. So kids are more likely to be resilient, which is really what we want, for kids to be able to bounce back and to face adversity and come out okay on the other side. And so things that are important for those kids are being able to discuss things that matter to them with their family and feeling like their family stood by them, that their parents participate in children's activities and knew who their children's friends were, and that the parents manage their own stress around parenting. And what that means is, when there are household stressors like financial stress or other kinds of adult issues, that the parents really, and the adults in the family really kind of keep that as adult problems, and they don't turn to their younger children to help manage that stuff. And we also know the kids do best, they function at their highest capacity when they're in a protective home environment. And so some examples of what that means are things like sharing meals together as a family, spending time together, doing whatever kinds of things your family likes to do, participating again in your child's activities as a parent, limiting their screen time, and we're going to talk a little bit about screen time in a few minutes, and having schools and a neighborhood that are safe and supportive. So we're going to look at what our own data says about some of these things, which is great that we have that.
I think the cool thing about this data set is that we don't just ask about substance use and risky behaviors, but we also ask about all those positive things that we can help to increase,
right,
that will help to make sure that you lower the risky things as well.
Yep, which is why we call our survey the Youth Health Survey as opposed to the Youth Risk Behavior Survey, which is what it's kind of classically known as at the state and national level. So yeah, it's important to us to find out what are the healthy behaviors of our kids as well, and what's protecting them from kind of getting involved with things that could be risky for adolescents. So let's pull up the protective home environment slide. So one thing that we know about our students is that most students at the high school and middle school have dinner at least 5 times a week with the people in their house, which is terrific. That's actually a very important protective factor. It's the time when families can talk about their schedules for the week and find out what's going on. All the, really just connecting with your kids and spending time together, talking about whatever's important. Most of our students, both at the high school and middle school, report that they feel close to their parents and that they share their thoughts and feelings with their parents. Slightly less at the high school than at the middle school, but I think developmentally that probably makes sense as an adolescent. Our students feel the sort of middle set of bars there, that their parents notice when they're doing a good job and they tell them. So that's really important to make sure that we're always telling kids when they do something right, that we recognize it, not just always talking about what didn't go well, but really highlighting, oh, you got a really great grade in this subject. How did you do that? How did that happen? And that parents are monitoring their kids' activities, and some of the ways we measure that is by asking kids if they believe their parents would know if they came home on time, and if they believe that their family has clear rules about alcohol, tobacco, and other drugs. So we score very well on all of these indicators. We typically do. This is great news for our parents. We want to encourage families to really keep up the good work. And then we asked some things about the supportive and safe schools. And again, we're doing well here as well. Most students at both the middle and high school feel like they have at least one adult in the building that they can talk to if they have a problem. That's really, really important. We want students to feel like it doesn't really matter who it is, but that there's somebody in the building that if they're feeling distressed or they're having trouble, that they can talk to. Most of our students feel like the teachers care about them, they feel valued, and they feel like they're a part of the school. And so these are, the blue and red, orange bars here indicate students who said that those statements were always or usually true for them. So that's really good information, I think, for us to have, and really positive feedback for our schools. And of course, this is information we share with them as well.
Yeah, I thought overall the schools just had really great data to show about how students felt that they were a part of the school, how they felt that they were supported at school, and I think that's just such a great point to highlight.
Yep, I do too. And it's stuff that we can track, we continue to track over time, and so we can see if there are changes and things that we need to respond or react to.
Yeah, of course, when we bring that to the school, they're only looking at how they can do better. So
right.
That's a great attitude to have.
Yep. And it's important to us that we use the data. So we always, Kendall and I talk about, the data is really a living document, and there's lots of stuff we can do with this data. We can sort of slice and dice it a million ways, and we will, and we do, and we spend hours looking at this stuff. But it's sort of most important to me that, when we go to the school and we say, hey, here are some of the things we learned, And of course, there's way more stuff that we learn than we could possibly share with you in one episode of this show, but that the schools are able to look at that and say, where can we do better? How can we learn from this? Wow, it looks like we are doing better in this place. What do we do differently over the last 2 years that maybe shifted this number? So that's important as well. So we're going to shift and talk a little bit about adolescent drug and alcohol use. And, and this is one of the places where people start to question the data, as Kendall had said. And so she talked to you a little bit about how we know this data is valid. And we do believe in this data, and I think that's important.
Yeah, so like I said before, there's tons of ways to check to make sure. I can never promise that one didn't slip through someone really tricky or someone really lucky. But, besides one or two, this data is so clean, it's so valid. You spend a lot of time just really checking and double checking and making sure that that it kind of meets all the criteria to be a clean data set.
Yep, which is terrific. So one of the things we know about the alcohol and other drug data is we have lots and lots of this data. And of course, I didn't put a lot of slides in here today because we wanted to be able to talk about a multitude of health issues. But we know it's really important to try to really delay the first time kids get involved with alcohol or other drugs until they're past the age of 15. That's one of the magic numbers. And certainly we want to try to delay it as far past 21 as we can. But kids who experiment with drugs and alcohol before the age of 15 have a 5 times increased likelihood of experiencing issues with dependence or addiction later on in life. And so those are very significant issues that we would like to avoid. The risk for kids sort of trends down as they approach 21. And so, ideally we want to try to prevent kids from experimenting with alcohol and drugs till they're past the age of 21 for those reasons. And really, actually, a lot of that has to do with brain development too. And it's the reason those kids are more susceptible to addiction issues later on, is that the brain is actually developing until kids are 25, which seems crazy. Most kids are sort of off into the world at that point, but really our brains are still changing significantly. And so when we introduce things like alcohol and other drugs into a developing brain, the repercussions are much more serious for our younger people. So let's look at what we know. So we have a slide here with some lifetime use of substances among our 8th graders. So this is a snapshot of what our middle school kids look like as they're sort of moving towards graduating from the middle school. So we do the survey in February every other year. So they're approaching the end of their time at the middle school. By the time they are halfway through their 8th grade year, about a quarter of them have experimented with alcohol. About 6.5–7% of them have experimented with marijuana, very few with cigarettes, and 8% with e-cigarettes. So vaping, electronic devices. We don't know, because the question doesn't ask what are in those devices, but we know that's our e-cigarette rate. This is actually the first time we've ever asked about e-cigarettes. So we don't know what that's looked like historically. I have no idea if that's a high number or a low number for Stoughton, right?
In 2 years, we'll have a much better idea of what the trend looks like. So
yep.
The first time you survey something, it's interesting, but the second time you survey something, that's when you really have something to work on.
With. That's right.
Certainly the number, just knowing that so many kids have experimented with e-cigarettes is kind of concerning, but we won't know which way it's headed for a little while.
Right. And so those lifetime rates, as we've been saying, really indicate kind of experimentation. Those aren't kids necessarily. A quarter of our 8th graders are not regularly using alcohol. It means at some point in their life, they had more than a sip or two of an alcoholic beverage. So that's important to note as well. But as we had said, it's important to be aware of that age of first use, and that's really what that question gives us. So let's look at the high school. We're going to look at the same question here for the high school, which is, if they had ever experimented with any of these drugs in their life. So this is an average of all high school students, 9th through 12th grade. And so about 42% of them report that they've experimented with alcohol. 27% with marijuana, cigarettes at 7%. E-cigarettes came in pretty high at 27%. And again, we have nothing to compare that to. Prescription drugs, and that means using a prescription drug in a way that it's not intended. So generally, we're looking for kind of recreational use, and as opposed to I needed an antibiotic because I had strep throat. And the 0.3% there, which is hard to see because of the logo, is heroin. Very, very few of our students at Stoughton High report ever using heroin. I know it's a number.
0.3, I think that correlates to 1, possibly 2 surveys.
Right.
So,
keep that in mind.
Yeah, keep in mind that even though it's showing on the radar, it's 1, it might be 2.
Right. And I think, and this is where it's also important where we think about that hope and concern. So any student who reports that they're using any of these drugs, and we talk a lot about heroin because it's in the media, and the prescription drug issue, obviously an area of concern. We don't, but this survey does not allow us to ever know who these students are. Even if we wanted to, we can't. We don't ever look at the data that way. It's literally just like a page of numbers, right?
Right. We were talking about this earlier. So I literally get a spreadsheet that is zeros, ones, two, three, fours, and fives, and there's 300,000 of them. So that's a lot of data points for me to ever think that I would possibly have the time to look through and
right.
see who is who. And even if I did have the time, it would absolutely be impossible.
Right.
We don't ask many demographic questions beyond gender at all, I don't think, so it would be really difficult to have any idea.
Right. And we want to keep it that way because we want students to really be able to tell us the truth about what's going on with them. And
right, there's no need.
Right, because we're not using the surveys to try to identify students at all. The place that we do that actually is at the high school with the SBIRT program, which is a new initiative that we started this year that's actually, it's state mandated now that the school nurse meets with every 10th grade student and does a brief interview with them. It's confidential, and it's around drug and alcohol use and trying to do a quick risk assessment. And so, those are the kinds of ways that if a student is sort of personally having some risky behaviors, that there's an opportunity for the nurse and the guidance staff to intervene with that specific individual. Surveys aren't the place where we can do that because we don't know who students are.
But we ask the same questions on the survey that the school nurse interviews the students with, which is so great because then we can look, if these questions are asked anonymously versus if they're asked in a one-on-one situation, how well are we doing at getting people to feel comfortable to speak, what they said anonymously? So I think it is kind of interesting to see what our rates are in person versus our rates are in the survey, which is anonymous, and so that is, I think, helping to guide the SBIRT program going forward.
Absolutely.
As well.
Yep. And it also allows us to share with kids that most of their peers aren't engaging in a lot of these behaviors, and that's a really important piece for a lot of the work that we do in health education and in these one-on-one situations to really validate those students who are making really great choices around alcohol and other drugs, and to kind of talk critically with students that are using around, what's really happening in their environment. And actually, so let's talk about misperception for a second. So one of the things that we know, and this has actually been true for our data over the years, and it's been borne out by the research. A lot of this is research, again, that our colleague Dr. Linkenbach is doing, is really the difference between what students are actually doing with their behavior and what they believe. And this happens in every high school, in every middle school. This is not different to Stoughton High, but those orange bars on your screen are the actual use rates, and this is our 30-day use rate. So when we say to students in the last month, how often did you drink, use marijuana, or use prescription drugs? So it gives us a snapshot about what's happening now. And the blue bar is what they think is happening at the school. Do you think the average Stoughton High student uses alcohol or uses marijuana? And the gap between those two bars is one of the things that we also look at as a data point. It's really important. If that gap is really big, what that means is that students believe that most of their peers are doing a behavior that's not happening, and it can generate almost a false peer pressure for kids to use, because if they believe that on Saturday night, most of my friends and peers are out drinking, if they were on the fence about that behavior, that may influence their decisions. And so we really want to make sure we're sharing the truth with students about most students are making good choices, and our numbers are actually really low.
One of the things I think is interesting about that is that not only do we ask, what people are doing versus what they think other people are doing, but you go so far as to ask, who do you trust to give you your information? So when we have those great data points like, most students aren't using alcohol, well, how do we get that information out to the students? And I think that, we ask questions like, who do you trust? Do you trust, how believable do you feel the police are, a flyer, the internet, your coach? So it's really great to help you to guide your interventions and to try to figure out what the best way is to get a message across to the students.
Yep.
And I think that's something that Stoughton has used over the past 10, 12 years when they've been doing this survey, is they've always been really smart about the best ways to portray this message to make sure that kids really get a clear picture of the latest information that we have.
Yep. And I think for parents to know, parents came out as like number 2 as a valid source and a trusted source for information about alcohol and other drugs with students. So if you think your child isn't listening to you, they are listening to you.
And they trust you.
And they trust you, and they think you're giving them good information. So I think that's really important. Let's talk a little bit about driving under the influence, and I'm gonna zip through this a little quickly because I want to share some other important info here. So at the middle school, we asked kids in the last month, how often did you ride in a vehicle driven by someone who had been drinking alcohol, we're assuming prior to being in the vehicle, using marijuana, and then texting or using their mobile device for something other than talking on the phone or GPS. What's concerning here is that my guess is that most of these kids are riding with grown-ups in their lives, and there's a lot of phone use happening in the car that might be modeling for kids. So it's something to just be aware of. Those devices are so tempting in the car because they do everything. But I think that's important. At the high school, we're actually able to look at both student drivers, and so we know that most of our students are making pretty good choices while they're driving. More concerned, again, the highest numbers around driving while texting or using the internet. And then when we look at riders, did they ride with someone who had been drinking or using marijuana or texting? Those numbers are higher. So students are more likely to ride with somebody than to do it themselves. And we don't know who the driver is. In this case, it might be a peer. It might be an adult in their lives. It could be some mixture of both. Things that we need to learn more about and that are concerning and, dangerous behaviors that we need to pay attention to. So we want to talk a little bit about screen time, sleep, and exercise as we sort of wrap up here. And so when we started to pull apart this data, I went to the American Academy of Pediatrics website and I looked at what the recommendations were around screen time and sleep. And so this has context for folks. The American Academy of Pediatrics actually doesn't make recommendations for the number of hours a child should be on their screen, but they do say that it's really important to know that screen time can interfere with sleep, with play, with physical activity, with actually with engaging with a person face to face. And
this question was worded as screen time not related to school.
That's right.
So this doesn't count homework and screen time at school. This is for personal,
right?
Whatever else happens.
Right. Yeah, whatever else they're doing with their phone, their mobile devices, their computers, any of these things. So yeah, and these are on school nights actually too. So this isn't even about the weekend. So we do know that both at the middle school and the high school, a lot of our students are using their screens for 4 or more hours beyond what they are using for school time. And in some cases, I can't speculate, but in your own household, you'd have to think about does that leave enough time for physical activity, for play away from a screen, for interacting with your family, for having dinner, and for getting enough sleep. When we look at sleep, actually,
we don't think it leaves enough time for sleep.
It doesn't look like it's leaving a lot of time for sleep. So again, the American Academy of Pediatrics, which I think is a really good source for this kind of information, recommends that kids in middle school get 9 or more hours of sleep a night, and they recommend 8 or more hours of sleep for high school students. So here you see in the green bars under middle school, and then 9th, 10th, 11th, and 12th graders are students who say that they're getting more than 8 hours of sleep. And what's interesting about this chart, I think, is that, the kids who are getting less than 6 hours of sleep at the far right in red increases as our students get older. And I'm guessing also they're modeling some of that behavior after us as adults because many of us do not get enough sleep. And there's a lot of new research about how really important sleep is for, sort of being able to focus, for your own health, for weight management, mental health, all kinds of things. So this is really important, and it's something we need to be thinking more about. And so this is the first year we've asked about sleep. It's a pretty interesting piece of data, and I think it's something we all want to think more about and talk about and think about with our kids. One good rule of thumb for parents to think about is if screen time is one of the things that's interfering with sleep, and I think for a lot of kids it is because they're going into their rooms at night with their device, and then they're up all night on Facebook or other social media. Maybe it's not Facebook anymore. That's probably Facebook is out for teenagers. But that there's a lot of research both about the light that's emitted from the screen and how that's disruptive to sleep, but also just kids being connected all night long isn't usually healthy for them. And so There are a lot of tips, and the American Academy for Pediatrics is a good place to look for this. The Youth Commission has some information that we can share as well, really around how to manage that, and ideas around maybe having all your devices charging in one central place in your house that isn't your child's bedroom, or at a certain hour you manage the devices, or you shut off their ability to use Wi-Fi.
I saw a new thing where you can turn off your Wi-Fi for your kids' devices.
Yeah,
that's awesome.
Yep. So there are lots of things out there that we can do as parents, but
I don't function well on less than 6 hours sleep. I don't know. I don't think I got that much sleep in high school, but now that I'm older, I've learned how important sleep is, and I couldn't imagine sleeping on average less than 6 hours a night.
Yep. And it's particularly important for kids. And even going back to that developing brain thing, it's that is the time when your brain is changing so rapidly, that uses a lot of energy too.
Totally.
So if you think about what it takes to learn new skills, and your brain is sort of doing all these things, you don't even think about it, but it's happening, and so that's important. So our last slide here is about other healthy behaviors, which exercise and eating healthy food. Our kids, our high school students, are reporting they're actually doing great at this. They're doing better than they were the last time we surveyed in 2015. More of them are reporting more exercise, more fruit consumption. We aren't able to really talk about vegetable consumption because the question changed a little bit, so it's hard to say if our kids are consuming more vegetables. But
I'll tell you in 2019.
Right? Yeah, we'll know in 2 years. And fewer of them are reporting drinking soda, although the question doesn't talk about diet soda. It only talks about sort of Coke, Pepsi, the products that are not diet products. But I think that's really great news as well. So I think there's a lot of stuff for us to celebrate in this survey. There are some things for us to be concerned about. There were a million, well, not a million, but a lot of other questions in the survey that we didn't even get to talk about today because we are literally just about to be out of time. But what I want to thank Kendall for coming and
thank you so much.
Yeah, and being excited about this stuff with me. I want to thank the Stoughton Public Schools, because without the Stoughton Public Schools, we would never be able to collect this kind of information. This is data that belongs to the community. This is Stoughton's data. It's collected really in a partnership between the OASIS Coalition and the Stoughton Public Schools, and we really couldn't do it without them. We couldn't do it without Kendall's support here as our evaluator and trying to understand what all this stuff means and making it meaningful in plain English. So lots of folks involved in this work. And if anybody is interested in learning more, you can, let me throw out my contact info. You can reach out to me at the Youth Commission. I'm happy to answer questions, and I'm happy to come and do a data presentation for anybody who wants it. So thanks so much.
That's awesome.
All right. The end.